I want to thank all of you who are attending this evening's panel. We have a wonderful slate of panelists who will be talking with us today about COVID-19. My name is Olivia Garcia. I am a professor of history here at Bakersfield College. And with us today, we have Michelle Corson, who's a program manager and public relations officer with the Kern County Public Health Services Department. We also have Connie Perez-Andreesen. She is the Chief Administrative Officer with the United Farm Workers. We have Jay Tamsi. He is the co-founder of the Latino COVID-19 Taskforce. He's also the president and CEO of the Kern County Hispanic Chamber of Commerce. And last but not least, we have the wonderful Bianca Torres. She is the hotline manager for the Kern County Latino COVID-19 Task Force Hotline. If you're joining us soon, this is the dialogue on COVID-19, the vaccine, and your health. And I am really happy to see all of you join us today. This is an event that is put together by the Bakersfield College Women's History and More, which is also known as WHAM, and the Office of Student Life at Bakersfield College. Together, you are able to see this event. I believe it's also being shared live on Facebook. Before we begin with questions, I want you to know that we have a series of questions we will be asking our panelists. If you do have a question you would like to ask, please submit those in the Q&A chat box, and we will try to get to those as soon as we can. We'll save those towards the end, though, because we have a couple of questions we'd like to ask them as well. Okay, so with that, I would like to ask our panelists to please introduce themselves to our audience. So if you can share maybe 3 to 5 minutes to introduce yourselves, that would be great. Why don't we begin with Jay, and then Michelle and Connie and Bianca.
All right, well, thank you, Olivia, and thank you, WHAM, for having me today. My name is Jay Tamsi, as Olivia mentioned. I'm the president and CEO of the Kern County Hispanic Chamber of Commerce. We are a membership-driven organization, and a nonprofit, and I'm also the president of our Kern County Hispanic Chamber of Commerce Business Education Foundation, which we provide scholarships to graduating high school seniors, and as well as we offer our Kern Energy and Ag Academy through BC. And so maybe some of you are familiar with our Energy and Ag Academy, and we also provide scholarships through there. So at the Kern County Hispanic Chamber of Commerce, we are here to be an advocate for Latino-owned businesses, those who cater to Latinos, and also to anyone who would like to join. So 60% of our membership is Latino, 40% is non-Hispanic, non-Latino. So we are here to provide business services for free. We have what is called our Kern County Business Academy. It's an 8 to 10 week course, and you learn how to grow your business, or if you're an entrepreneur, we teach you how to execute your business, create a business plan, and also how to market your business, and make sure that you're on the right track with marketing and CPAs. We bring in CPAs so that they can teach you how to keep track of all your finances. And in addition to that, we have business services, monthly business services meetings, and that has a lot of small businesses that we cater to. They do not have an HR department, so it's really hard for them. And so as a member of the chamber, you're able to come on and now Zoom, but prior to our office, and you're able to take some HR classes, and these are all complimentary. We work very well with Klein Denatelli and also some other firms in town. And so we also have government relations committee, and what it is, and basically we have guest speakers who are elected officials or perhaps some superintendents, presidents of Bakersfield College or CSUB, University of Laverne, and we just want to hear, we want an update. We want an update from locally, and then we also want updates from the state or the capital. We were very honored to have last year our Lieutenant Governor, and she was one of our guest speakers for government relations. We are a nonpartisan organization, and which means we are not able to endorse a candidate. We just have to stay very neutral. We're very business, obviously business friendly, very business pro-business. And so when there's initiatives on the ballot, we make sure that or when there's initiatives on the ballot, or there's initiatives that come up regarding small businesses, we make sure that we're advocating for them. So with that being said, there's lots more. We have tons of events. We have business networking, mixers. You get to know other folks for a few hours once a month. Right now, we're not having any mixers, but it's a good way to get your business out there. And so with that being said, we also host a really large installation gala where we present awards to folks in Kern County who are truly deserving of these awards. The Latino Food Festival, Menudo and Pozole Cook-Off, which is our largest fundraiser of the year. As a nonprofit, we have to have these fundraisers in order to survive. And also the Dia de los Muertos, which is really big, got even larger after the movie Coco. And so, we just really try to emphasize, and we want to make sure that we want the folks to know that this is our Latino culture. This is how we celebrate. And we want to share our culture with other cultures as well. So this is not just for Latinos, these that I bring up. And we also have a business conference that we host every year. So I'm going to switch to the Latino COVID Task Force. So I co-founded this task force, and we met with Michelle and our Director of Public Health. We saw the need for Latinos. We saw the numbers increasing, and we wanted to help public health, and we wanted to be there to make sure that we bring ideas and solutions to Kern County Public Health, as well as the Latino community, and promote education and awareness. So with that being said, that's just a little bit of what I do. And I'm gonna go ahead and hand it off to Olivia. Thank you.
Thank you, Jay. You're indeed a very busy person, but do a lot great work for the community. And it's really an honor to get to work with you on different fronts. Michelle, how about you tell us about yourself?
Hi, thank you so much. I'm honored to be invited with my esteemed fellow panelists. I am from Kern County. I'm born and raised in Kern County. I actually am from Tehachapi Warriors, if there's any listening. And, I love this community, and I'm fortunate enough, I graduated from CSUB and in communications and public relations. And I had a real passion to serve my community. So I've worked for the county of Kern the majority of my career, but I've been with Kern County Public Health, which is where I am now, for the last 5 years. And it's my dream job. And I truly love what I do. And really, Kern County Public Health, a lot of you know us now because of COVID-19, right? We're kind of on the front lines of kind of fighting this pandemic. But Kern County Public Health has many facets to it. We have our public health branch, which is kind of the lead on disease control and prevention. But we also have our environmental health division. So if there was, for example, an overspray, right, of pesticides, for example, it's our environmental health team that will be one of the folks that would respond to something so tragic as that. So we have a very robust team that responds to emergencies. And that was just an example of one that would be. Also, we have our emergency services division, and we oversee and regulate all of the ambulance services in Kern County. A lot of people don't really know that about public health, but that's another part of what we do. So we're a very exciting department. I am honored to work for the public health department, but you will hear more about this evening. But public health, all we've done for the past year is fight this pandemic. It's been all hands on deck, and it's all we've done. So to be here tonight, and I will say, Jay Tamsi, I'm a proud member of the Kern County Latino Taskforce. So that's another thing I must say. And I'm just very proud to be here. So thank you.
Thank you very much, Michelle. My good friend Connie, I would love for you to share your story.
Sure. Thanks again, Olivia, for inviting me to be part of this panel. I grew up in Tulare County. I grew up in a labor camp, the Woodville labor camp, for most of my childhood. I was there until I was 17 years old. So I have ties, obviously, to the farm working community. My parents were both farm workers. I moved to Bakersfield to attend Cal State CSUD, and I graduated from CSUD a while ago. Before that, I did classes at Bakersfield College and also Porterville College. And I graduated with a degree in public administration with an accounting, business administration, sorry, with a concentration in accounting. So I'm a CPA. I was a partner at a local CPA firm. I was there for about 15 years. And I decided that I wanted to make a career change and work for an organization that I was passionate about. And I reached out to the United Farm Workers, and I happened to be looking for a controller. So it was a perfect fit. And I've been with the United Farm Workers since 2017, so almost 4 years. I started as a controller, but then I'm now the chief administrative officer for the union. And I was also appointed to the executive board in November of last year. So I'm also a board member. So it's been, for me, very rewarding this last year to be part of an organization such as the United Farm Workers that's helping our farm worker community, because that's, as mi gente, that's where I come from. So it's been very rewarding. And yes, Jay, thank you again for inviting us to be part of the Latino Task Force. That's been very helpful with educating our not only Latino community, but farm workers, and also a proud member of that task force.
Thank you, Connie. I can't wait to hear more about the great work you guys have been doing. Bianca, please share with the audience about yourself.
Yeah. Hi, my name is Bianca. I'm the hotline manager for the Kern County Latino COVID-19 Task Force Hotline. And a little bit of my background is I actually went to school at UC Riverside, and I have a degree in psychology. I was teaching math and science after that in LA to middle school and high school students. And then I actually decided that I wanted to go back to school, and I'm applying to medical school right now. So it's been kind of a crazy journey for me. And when I joined the task force, I've known Jay for a long time. And when COVID hit, I have friends that are teachers, I have friends that are moms, and, I have a really big family. So not being able to see everyone was really difficult. So when we got together to make the hotline, the mental health aspect was really big for me, because I knew there was a lot of people suffering, and not a lot of people get help in general. So if they're going through a lot of issues, having a lot of issues, in normal day-to-day life, throwing on pandemic on top, it was going to be worse. So that's why we started the mental health hotline. And we've started December 15th, and it's been going really well. We get hundreds of calls a week. And for people that want to talk, we have counselors available. We have about 10 counselors available that can give a free up to 30-minute session. And then we started Project Abuelita. And Project Abuelita was more for, the people who, that are older community members that don't have access to the internet, that don't have a computer, maybe don't have family. There's a lot of different reasons as to why people can't get information about the vaccines or learn how to sign up for the vaccines. So I try to keep up with what the CDC says and what our public health says to, relay that information to, so they know what the vaccine is and and they're also learning as well. And so Project Abuelita started at the end of February, and man, it's been a hit. So a lot of people are calling in to get help, and we're just really happy to give back to the community.
Thank you. And I look forward to you sharing a little bit more about Project.
Yes.
My next question is, so much has changed within this past year from March to March, right? When the moment a year ago this month, we were ordered to go to shelter in place, to seeing different times of spikes of COVID positivity rates, to now this huge vaccination effort. I'd like to ask each of you to tell us how COVID-19 has impacted the work that you do, and what has been a constant goal for you, for those you serve, or your organization. And so why don't we start with Jay?
Okay, well, let me see. Let me go back to the question here. I'm so sorry. So obviously, as Olivia mentioned earlier, in the evenings, it's about, awards and dinners. Lunchtime, it's about recognition and going to lunches. But as the president CEO, it's more than that. You're the face of this large organization who is affiliated with the California Hispanic Chambers of Commerce. And when the pandemic hit, I have to be very honest, as there's so many other things going on in this country, you don't really think that something's going to stick around as long as this pandemic has. And so in my job, not only is it constant meetings and going to events and putting on fundraisers and dealing with staff, we had to learn just different ways and techniques on how to get by every single day. And so, how to get on Zoom and download it. And I'm not very tech savvy. We're a small we're a large organization, but we're nonprofit. So I don't have an IT person. So, just learning Zoom. I will tell you that as I'm also Filipino, so being Latino and Filipino, you don't really think that one can get the pandemic or someone that or a loved one. And recently in Bakers of Life magazine, I shared my story with folks, and that was really very difficult for me in the beginning, because I was one of the very few, or the first, to get COVID. After I said, I don't know what this is all about. I don't know this pandemic. It doesn't mean anything to me. And blah, blah, just the mentality, because there was no education. And so in a nutshell, I did get COVID. I was misdiagnosed because they didn't know. Doctors didn't know. 3 doctors didn't know. They thought I had a severe cold. So your mind just shifts a different way. As far as staying home for 45 days by myself, being isolated, not eating for 30 days, and it's a very scary feeling, and I wouldn't wish it upon anyone, although we know the numbers in our county and we know the numbers in our country. It's just a very scary and very serious pandemic. And I knew, one, I couldn't buy my way out of COVID. Two, I couldn't call a politician to fix it. Three, I couldn't have my parents around me because they're over 65. So I did a lot of soul searching, and I'll say I did a lot of praying. And after that, I had much more respect for folks such as public health, that were providing us information. And so although I understood it, I had to realize that there's Latinos living in rural areas in Kern County, Lamont, Arvin, Chapter, Delano, Wasco, that they were not really understanding it. Not everybody watches Telemundo, not everybody watches Univision, but shout out to them, because they're big supporters of ours. But we needed to do something. And so we partnered with Kern County Public Health. I felt for our Latino community. I felt for the farm workers. I felt just horrible about it. And I'm really not one that just sits there and does absolutely nothing. So nobody knew about this and me having COVID and being one of the first. And, I even, honestly, with Michelle and Bryn, Director of Public Health, I've never even told them. And, as we started to get together and started to form this Latino COVID-19 task force, we had to switch directions. We are a nonprofit organization that we're helping businesses, and we're helping Latino businesses and businesses in general. We're advocating for businesses. We want people to survive, but we had to shift our direction and help our community. If we didn't help our community and we didn't focus on outreach and awareness and PSAs in Spanish and campaigns in Spanish, our Latino community wouldn't really understand what was going on and how serious it was. So we completely shifted. We still had our business seminars and our government relations and things like that via Zoom, but we got much more involved in the Latino task force, which all of the folks that are on this panel today, I'm very thankful for, because everyone adds, including Olivia, everyone adds a little and a lot to the task force. And so, our mission statement is to save lives. That's basically what we wanted to do, which save lives. And so everything kind of shifted for me, and not being very tech savvy, it was a little difficult. But as time progressed, Zoom became available. We were able to find ways to get restaurants open a little faster and communicating with the county supervisors. And so, that was really, really important to me. And a lot of our businesses took a hit. So a long story short, now I feel like our Latino task force, I feel that we are very powerful. We have 30 prominent folks who are on our task force. They all care about the community. We meet every 2 weeks, sometimes every 3 weeks, depending on schedules. And then we just went on, and Michelle called, and we started doing COVID testing. And that was just another thing that we had to get through and get people on board. And so it's just changed my life. And I will say this, as I had COVID, I did download TikTok, and that has to be the most craziest thing ever because I'm not that social media savvy. So, and I don't get on it. I don't have time for it, but the TikTok really got me through it. I don't even know how through this whole 45 days. You know, I know it's funny, but it really did. And for those of you, you know, please kind of be PG when you get on there. There's a lot of crazy stuff on there, but I went to like the Filipino and the Latino, you know, stuff. So that's a kind of how my life changed, and the chamber and this Latino task force.
Thank you, Jay. Yeah, TikTok has become a favorite for many. Michelle, how about you?
Well, and thank you, Jay, for, I don't know, letting us maybe get a little personal. I'm so used to every day I talk to the media as the public relations officer for public health, and I've been doing so for the entire pandemic. And, you know, you don't get to kind of let your guard down and just be personal, you know, but back to your question, Olivia, the goal of public health, you know, is to protect the health and slow the spread of any communicable disease, which COVID is. And that's why we literally dropped everything. Every employee in all of our divisions, their jobs changed immediately. Full-time, all employees of public health, it went to COVID-related duties. And that has been everything from sharing the information that flows from the federal government to the state Department of Public Health, down to the local public health jurisdictions. That information has been a continuous flow through the pandemic. It changes every day. Some of the things we were saying at the beginning of the pandemic are completely different than what we're saying now because we've learned it's a novel virus, right? So things have changed rapidly. But, you know, our focus has been to provide the most accurate, quick information to our residents as quick as we hear it. We're trying to pass that information on. How do you stay safe? How do you prevent yourself from getting sick? If you get sick, what do you do? Then, you know, as the governor implements some of the protocols around our businesses and our activities, this is so foreign to us. When are we ever told what we can and cannot do? It's crazy that we have found ourselves in a position where we have to articulate these messages to our community as the local public health jurisdiction. It's just been crazy. You know, we're not law enforcement. We educate and we protect the health of our residents and we tell them how to stay safe. So this has just been a whole different thing for us, right? And that's what we've done though through the pandemic is pass along the factual information because you guys, there's a lot of misinformation. And that's really been our calling. And I like to talk about the communications aspect because that's my role as the public relations officer. That is my absolute priority every single day. And when I give the messages that I give when I talk to the media and I talk to the community, I'm talking to my family. I'm talking to my neighbors. This is where I live. This is where I've grown up. And Jay shared a personal moment, and I will too. For me, the pandemic had been in the very beginning stages, and I was doing press conferences by myself the first 3 months. And then luckily my bosses took over, thank goodness. And it was so scary, by the way. So I was delivering these messages, right, of what we were learning about the pandemic. And when it hit me that our world had really changed, I was taking a walk and a woman sees me on the street and she comes up to me and she's crying and she's like, are we going to be okay? Are we going to make it? Because, you know, I'm the girl on TV at the time that was talking. And that just really got to me. You know, it's like this was affecting every single person in this community. So the call at public health remains the same. Communicate what we learn on a daily basis and work to protect the health of our residents. And we take that very, very seriously.
Wow, thank you so much for sharing that. Connie, Please share with us.
So yes, just like Jay and Michelle mentioned, our world was turned upside down, when this happened back in March. We, as an organization, had plans for all of our different departments, offices of what 2020 was going to look like. And then when, March came around, we immediately shifted our priorities to, protecting our staff, but also our farm workers. And internally, I handle the finances for the union. And when I arrived at the UFW in 2017, I came from a paperless environment and there was paper everywhere. And I thought, I can't work like this. So I started to transition to a paperless environment. So when we were forced to work from home, it was a seamless transition because the staff were trained to do everything, without using reams and reams of paper. So it was great because it allowed us to continue to provide services to our members from our houses. So that's been great, definitely challenging working from home, especially when my entire family was home and a teenager and a toddler at home and my husband. That was very, very challenging. And then as far as our farm workers, what we do with them, it involves a lot of face-to-face interaction. We're out there with them at their place of employment. We go visit their homes, after hours to provide whatever services they need. So we couldn't do that initially. So that was very hard for us. So there was a lot of phone calls, to talk to them and letting them know what we were going to do. We helped with securing PPE that we distributed throughout California, but also in other states, in partnership with our sister organizations, the UFW Foundation and the Cesar Chavez Foundation, and also working with the Latino Taskforce. They've been very helpful in, protecting this community. What we also did last year is we bought our members tablets and we showed them how to use Zoom, which was, it was great because we had our convention, which we hold every 4 years at Rabobank. It's a huge convention and they all look forward to this. We usually have the governor or, we've had presidents there before. So it's a big deal for our members. And this year we had to do it virtually. So a few months before the convention, the virtual convention, we shipped them all their tablets and we had our teams on the ground meeting with them one-on-one, socially distanced and teaching them how to use the tablet. So when we have this convention, there's, hundreds, thousands of people on these little squares and you could see all these farm workers with their kids in the background. The kids were trying to help them figure out, how to use the chat or how to unmute themselves. So it's just been a complete shift from what we're used to doing at the union. We're obviously advocating not only in Sacramento, but at the federal level too for farm worker protections as far as legislation. And what we've been doing is holding weekly trainings with our membership using the Zoom tablet. Via Zoom. So that's how it's changed.
Lots of changes, but some things for the better too, that what you've shared.
Yes.
Bianca, tell us about your experience.
Yes. So I had actually applied to be a research assistant at Kern Medical Center back in last March. And it was put on hold because of COVID. They weren't allowing anyone to the hospital. So I was kind of just waiting. And at the time, my dad actually had to have a major surgery and we were just scared as a family because we were scared for him to go to the hospital to have this done. And we basically wanted to send him away, him and my mom, just lock him up somewhere so they would stay safe. But I didn't see my brand new niece for about almost 3 months. And so it was pretty hard to adjust to because I just basically had to stay home to wait for Kern Medical to say it was okay for me to come. And in this time, my family turns to me a lot when it deals with medicine or things like that. They think I'm a doctor, but I'm not. And so I have to remind them that I'm trying to apply to medical school. I'm not a doctor. And so they were asking me so many questions about COVID. And so what I would do is just, just try to do as much research as I can, put it into terms that they understand, and just, teach my mom, because my mom just really didn't, understand these words and things like that. And so, I would try to keep everyone calm. And, if anyone was going through it, like I would tell my family, like, you can call me, like, it's fine, And so then I finally got the call from Kern Medical Center, and I started in June. And the hospital was just like a ghost town. I'd walk in there and I'm like, is it usually like this? And they were like, no, it's COVID. No one's allowed in, basically. So I was a little bit scared because I was with the Valley Fever. I am with the Valley Fever Institute, and I do go into, I have patient interaction, and I consent them to our studies. And so I was nervous. I would wear my N95 masks, constantly washing my hands, hand sanitizer if I didn't have it. But every time I would like come out of a room, I just hand sanitize. And then when I saw a bathroom, I would go wash my hands. And so as soon as I come home, I'd go home and take off my clothes and shower real quick. And I was worried for my family mainly, because there was a lot of people that, that I live with, that they were still home or working from home. And I was the one going out. So I was afraid that I was going to bring it back to someone, especially being in the hospital. Thankfully, we were all fine, and we didn't have any, a little bit of scares from going to work and stuff, but we've been fine so far. But what I realized is that I had to be the person to explain everything that was going on to my family. And all of our patients with the Valley Fever Institute, a lot of them are Hispanic, and they have flip phones. They don't know how to look up what COVID is or anything, or they didn't know how important it was to wash their hands or how to wash their hands properly. So I would show them, to wash your hands and things like that. And it just got me thinking as well that, there's just a disconnect for the Hispanic population. It's just a big language barrier on all aspects of what COVID was and everything. So with that happening, that's when I spoke with Jay, and we wanted to get the mental health aspect going for our hotline and everything. And so all that awareness that I do within my family, I wanted to bring it to the community as well. And so the best way for us to do was, start the hotline. And so, our lives have changed so much. And I know that everyone's had such different journeys, and all the hotline, I hear so many stories, so many of isolation stories. People don't know how to use their phone, so they can't even call their family. They forget their numbers. It's a lot of sad stories, but we just also wanted to make sure that they weren't alone. Because I think that's probably the easiest thing to feel during this time, is just being alone. And you think you're the only one, but in reality, everyone's feeling that way. And so you just we want to make sure that everyone knows that even if you're too scared to talk to your family members about that, you can talk to us about it and how you're feeling. And, we can help you figure out these emotions, because it's new. And so we just wanted to be here to help.
And that's great about the hotline, because I know you've mentioned that it was so popular that you guys even got calls from folks in LA County and elsewhere.
Yes, Oklahoma was the furthest one. I was confused, but yeah, all over California and other places, other states. So, but we're still happy to help.
Yeah. I want to remind the audience, if you do have a question, something you'd like to ask, please type it in the Q&A, and we will get to them as we approach the end of the session. But I do have a question that any of you can answer, or all of you. Pfizer, Moderna, Johnson & Johnson, which one is the best one to take? How do I know where to go? Should I just get the one-shot one? Can someone fill me in on that?
Do you want, I can go. I know Michelle probably has a better answer, but what I do is I tell people, when people call in, because I get this question all the time with the hotline, and I tell my operators, I've written out like what to say, and I tell them, Pfizer and Moderna has about like 95%, we'll just say 95% effective, and Johnson & Johnson is about 73. What I tell people, that the goal is to get to herd immunity. So we want things to get back to normal. We want everyone to be protected. So protection is protection. And if, Pfizer is available, then, go get the Pfizer. If Moderna is available, go get the Moderna. And if Johnson & Johnson is available, then go get that one, because you're going to be protected with all three. And just make sure if you get Pfizer, get your second Pfizer. And if you get Moderna, get your second Moderna. And Johnson & Johnson is just one time. And so that's what I tell people, that it's mainly best to just be protected, protect yourselves, protect your family, protect others that you work with. And that's what the goal is, to get to herd immunity so we can try to get back to normal. So there's hope.
Yeah, and I would just add, I fully agree. Well said. And, we thought at the beginning that we were going to have some resistance to the J&J, and we've been surprised. And we all had talked about this before, actually, this began this evening, that the J&J, because it's just one dose and that's convenient for a lot of folks, that's becoming more popular. The other advantage of the J&J is those trials were done when some of the variants that have begun to emerge were circulating. So I think that's another exciting piece of that particular vaccine, because now we know that variants are part of our world, which is typical for a communicable disease to kind of do that. The flu does this, right? So, but the absolute advice is get the first vaccine as soon as you are eligible. That is the rule of thumb that we really are encouraging you to do from the public health perspective, because they are all fantastic. That vaccines were created this quickly. The shortcut didn't happen on the work and the research. The shortcut happened that the production happened in tandem with these years of research that are behind these things anyway. So it's really fantastic what has happened, and that we have 3, now almost 4 vaccines that we can choose from.
And I'll just add, Olivia, that our movement entities, the Cesar Chavez Foundation, the United Farm Workers, the UFW Foundation, and the Latino Taskforce are holding a mass vaccination event at the 40 acres. We've been doing it for 2 weekends. And what we found was that a lot of the farm workers want the J&J. We offered it the first weekend, and Bianca, she could add something here, because the call center, as they're scheduling farm workers for appointments, they have the options to choose between the J&J or the Pfizer, and we were seeing that a lot of them wanted the J&J, especially because some of them aren't working right now. They're going to start working in the next few weeks, so they want to be protected. So we thought that was interesting.
Connie, didn't you say that even some of them had a say when they would show up to the vaccination site requesting it?
Yeah, Bianca, I forgot what you said. They told
me. When they would call into the hotline, they would say, "Yo quiero la vacuna, la one and done." And I would ask them, "You mean Johnson & Johnson?" And they'd say, "Yes, El Señor Johnson," or something. And so I would talk to people like that. But a lot of the farm workers calling in for 40 acres, there was a lot of calls in the beginning, but once they found out Johnson & Johnson was being available, there was just a lot more calls. And a lot of them were asking for it. And so a part of the survey was to ask that. And I felt like I was just Johnson & Johnson, Johnson & Johnson, Johnson & Johnson, because like what Connie's saying, like a lot of them were going back to work and they were just unsure when they could get the second one, but some of them were they rather just get one and just be done with it. And so, and be protected and be around their family. So, but I still tell them like the Pfizer is great as well. So it's just whatever's available is going to be the best thing, better than nothing.
Thank you. Jay, do you have something to add before I see some questions coming in? So
I don't have anything as intelligent as Michelle and Bianca have mentioned, but to be honest, I got mine early January, and I got the Pfizer, and then I got the second Pfizer. And I called my doctor last week and I said, can I get the J&J too? Just to be on the safe side, because I never want to experience what I experienced in my life a year ago. So anyways, take the vaccine when it's readily available to you, please.
okay, so whichever one you can have access to, take.
Yes.
Okay. We do have a question. It's from someone who shares, if I take the vaccine, can I hang out or can I hang out with my friends if my family and my friends took the vaccine? How does that work? You know, if someone takes the vaccine, you hang around with them, or can you hang around with those who don't have the vaccine? Can anyone share?
Well, the CDC says that if you have the vaccine, if you can be around other vaccinated people, but it's still recommended to wear a mask if you're around others that aren't vaccinated. I still tell people, I still wear my mask. I'm vaccinated because I'm with Kern Medical. I wear my mask everywhere. And I still, wash my hands and, keep our distance from people, and now I think I'm used to it, but it's kind of weird. I feel like I'm used to it now. But yeah, I tell people that, they still need to protect themselves. Even if they're vaccinated and someone's not, it's protection for yourself and for others. I don't know, Michelle could probably chime in a little bit more for that.
No,
but
and you're right. We say what the CDC says because we are still waiting for the California Department of Public Health to interpret the CDC guidelines, which they are in the midst of, and they're going to be issuing any of the statewide guidance, which we expect to really echo what CDC has said. So I would say an absolute incentive is that, according to the Centers for Disease Control, if you are around, if you're vaccinated and the other person's vaccinated, you can take those masks off. And I think right now that's really attractive to us. So let that be an incentive for you and your friends and your family when you can to get vaccinated. But definitely wear that mask still when you are in public, because we don't quite understand. The science is still needing to understand more. And especially with these variants, but keeping that mask on when you're in public is still important.
We have a question about, speaking of an incentive, it's for Connie. Connie, when is the next event at 40 Acres, and is it free, and how do we make appointments?
Yes, it's this Saturday and Sunday. I have to bring up the flyer to get the numbers for you. And they can make an appointment. It's for the farm working community. You can call Project Abuelita, call Bianca at 661-525-5900, or you can call the UFW Foundation at 661-501-4280. And so we are there Saturday and Sunday from 10 to 4. We do welcome walk-up appointments if people aren't able to make an appointment. And then we will be administering the second dose the weekends after Easter. So we'll be back out at the 40 Acres for another 3 weeks. What we also do at the 40 Acres, and we've been doing it for months now, is we've partnered, the UFW Foundation has partnered with World Central Kitchen. So we're also distributing meals to people. So as they're leaving the 40 Acres after receiving their vaccine, they get prepared meals to take home with them.
Okay.
We are looking for volunteers. If anybody would like to volunteer, just let me know.
Okay, sounds good. I put the UFW number in the hotline, so in case people want to volunteer or want to help. Bakersfield College also is having a vaccination tomorrow. If you go onto the Bakersfield College website, They only have so many appointments, and they're also taking walk-in between 5 and 7. So that's also another possibility for those asking. I do have another question though that has been asked by the audience, and it has to do with side effects. Is there one vaccine that has less side effects, or are you always going to get side effects, or what is the story with side effects? Because there's so many different stories that everyone's hearing. Can anyone answer that?
Bianca does such a good job.
I know this one based on, because I work with infectious disease doctors at Kern Medical Center. Dr. Hidari was one of the first doctors that received the vaccine on camera. And he was explaining it to people that it's, once you get vaccinated, you're introducing your body into a foreign object, basically. And so your body's first response is to fight. And when your body is fighting, it means you're getting fevers, you're getting chills, all like flu-like symptoms. And that's why you have symptoms afterwards. Now, everyone's different. So they are saying that it could depend on your immune system, if you have a strong immune system or a weaker immune system. So if you have a stronger immune system, your body's going to fight harder because it doesn't know what it is. So you might have more severe symptoms. And so that's why people have symptoms afterwards. But, if you're having something like you can't breathe or your throat closes up, that's different. You have to, call 911 or something. But if you're having, fevers, body aches, chills, muscle aches, those are all normal symptoms that you would get from vaccines, because a lot of people even get sick after the flu shot. So they're all normal. It's just your body figuring out what's going on. But it's just your body figuring out what it is.
I was vaccinated when my parents were, and after the second vaccine, out of my parents, my husband, and myself, I was the one with all the symptoms. I had horrible chills. I had a fever. So I was in bed all day Sunday. My husband just had a headache, but my mom, a little fatigue, but my dad, who's in his 70s, felt nothing at all. So I don't know if age plays a factor too.
What we're hearing at Public Health is, again, there's so much research that's happening on this, but it's really varying right now. Some of the theories are, if you're younger and have a stronger immune system, you might have more, it's a good sign when you are reacting. That's exactly what we're supposed to do, right? But the stories vary. And what we're encouraging, because again, this is still a new vaccine, it's based on years of research though, make no mistake, is there's something called V-Safe. And we're encouraging everyone that gets vaccinated. It's so easy. It's on your phone. You can download it with the CDC. It's cdc.gov/VSafe. It's an adverse reactions system because the CDC wants to know. And it will remind you also for your second dose, but they ask you questions. And if you're plugging in symptoms that don't seem right, someone's going to reach out to you. So we're just encouraging everyone, because the Centers for Disease Control is taking this seriously and they want to understand more the side effects that people are having. So we're just encouraging folks to do that. But Olivia, all 3 vaccines have these common side effects. I'm not hearing of one that is going to give you less of a side effect than the other. And I had a headache, but that was it.
Yes, I the same thing. It's different. I got my second dose today, and just a very light headache earlier, but that's about it. So it's hard to say, and I got the Moderna, but someone else could have got the Moderna and got some others, and I've read too about the younger adults might have their stronger immune system, so their immune system is working harder, and then they have that. Jay, is there anything you wanted to add before I move on to the next question?
No, as I echo everyone else. There's side effects to I think everything that we eat, anything that we drink, and this is just the norm when you're taking a vaccine, even as Connie mentioned, the flu. So I had a few side effects, and everything was good. My mom and dad, I'm going to be honest, I didn't even know that they were going to take the vaccine. I never pushed it on them. But my father and mother being over 75, my mom being a cancer survivor, I was a little apprehensive in the beginning. I was worried, and she didn't have any symptoms, any side effects after that. And my dad, being the Filipino, very active all over the place, working in the church and working in the yard. And the second one, he just had a minor headache. So that's it.
Thank you, Jay. I have a question for Connie. Connie, when you had your side effects, this is from the audience, did it scare you? I wonder if I'll develop the same symptoms and my body might not be able to fight it.
No, but what I did prior to that is I was in communication with some of my friends in the medical field. So they warned me that I might experience some of these symptoms. They're my same age, so they told me what they experienced. So I was ready for it. So that's why our vaccine was on Saturday. So I just planned on doing nothing the next day on Sunday. So if you could get it, on a day where you have nothing to do the next day, I would recommend that. And honestly, to me, it was a nice break because my husband watched my toddler for an entire day, and I got to sleep all day. So to me, it was actually a positive thing. No, so I was not scared, and it was gone by the next day. By Monday, I was up and ready to go.
Great, thank you. I do want to ask a question, and it has to do with common myths that you may have encountered in dealing with farm workers or the hotline or the public, Michelle or Jay too as well. Have you run into some common misconceptions or myths? And if so, what have they been and what has been the response? Who would like to answer? Connie, since I have you here, would you like to try it first?
Yes, what we've been hearing for the vaccine is some people saying that it's a chip, it's a tracking device, or that it's going to leave a mark and it's the devil's mark. So, pretty crazy things. That's what we've been hearing. So we've been doing a lot of educating of our community through Radio Campesina, the Taskforce, and just with our weekly meetings on our tablets with our members. So those are the two pretty extreme ones that I've heard.
Okay, thank you. How about anyone else?
I want to, the biggest myth I think is, and Dr. Alvarez, who's on the task force and a very prominent Latino doctor who mainly sees his patients are farm workers, but the myths were, if I take this, well, and I have a child, will they get autism? I think that was the biggest myth. So I know that when he goes on Radio Campesina, he's on Telemundo, I know that he goes back way back until, from the shingles to the measles to the smallpox, he'll give you the entire history. And there isn't really any science that shows that this is going to cause autism after taking this vaccine. So that's really the big one in the Latino community. I know that I've heard. Yeah.
Thank you, Jay. Michelle, Bianca?
I know with the hotline, when people call in, they all ask if they're being injected with COVID. I do have to explain that a lot of the time that, that it's the mRNA, so it's the messenger RNA. So it's teaching your body how to protect itself, like teaching your body how to make the antibodies, like the things that help fight it off. So if it were to try to invade your body, like your body is learning how to fight. So it's not a dead strain of the coronavirus. It's a part that's teaching your body how to fight it. And so that's how I've been explaining it to people on the hotline, just trying to make it as easy and simple as possible. But a lot of it that they were just scared that they were being injected with COVID, and if they were going to be test positive, if they took a COVID test for work, and I would tell them no, that they won't. So those have been probably the biggest myths that we get for the hotline. And then once I explain that to them, they feel a lot more comfortable, and then they're ready to, schedule their vaccine. So it's a lot of like just talking to them, making them feel comfortable. I let them know that I work with patients in the hospital, so that's why I was able to get vaccinated. Wasn't trying to jump in front of anyone. It's just, that's what I'm around. And it wasn't bad. My experience wasn't, I was actually going through a ruptured eardrum. So I was feeling bad already. And so the doctor kind of just told me, you might feel bad. Not any worse than you already do. So I decided to go through with it. And that's what I let people know that, it's protection, and, don't believe certain things, certain articles you cannot believe. Like, you have to read factual articles, go on the CDC website, go to anything that has a .gov. Don't go on Facebook and listen to, the guy down the street that is just saying things, listen to people that know what they're talking about. And I'm just relaying information that I read. And I always go, so I always told my students when I was teaching that if you want to build an opinion or do something, do your research. And since there's people out there that can't do their research because they don't have internet or computer, that's what we're here for, is to teach them as well through the hotline and try to bust down those myths, because there's a lot of them out there.
Thank you. Michelle?
Well, they've touched on most of the vaccine myths through the whole pandemic, though. In the beginning, it was COVID's fake. It's not real. And masks don't work, so there's been, I think, because again, this was novel to everyone. There was a lot of just things that just people were having a hard time grappling with. But I echo what Bianca said. Please, it's the CDC website or the California Department of Public Health. And we have all of those links at the Kern County Public Health, kernpublichealth.com. You need to get reliable information. This information is troubling that is out there. So that would be my big ask, is go to these reliable sources. The Latino Taskforce has been such an incredible voice, because as you hear, they are providing accurate information. It is so needed right now. So thank you.
Sorry, I have another question that's coming from the audience, and it has to do with masks. Is there going to be a point to where we can finally take off the mask in public?
Well, I'll start. I'm sure there's going to be a day, but it's not anytime in the near future, we don't think. The vaccine is really the hope right now, right? So I think if we continue on this path, we try to listen to the Centers for Disease Control and their guidance on this, and the state. No one's giving a time when masks are going to not be part of our life to some extent. But the good news is, do you hear the key? The CDC is saying, if you're both vaccinated, you can take off the mask. So we're starting to progress forward. So the more people are vaccinated, the more herd immunity we achieve. We go through the seasonal flu every year. The flu spreads in a very similar way. Every year during flu season, I tell people, wash your hands, stay home if you're sick. It's kind of the same messaging over and over. And over time, because of vaccine and herd immunity, we're not having to wear masks to prevent the spread of the flu. So there's going to be a day. I don't know when, but the more of us that get vaccinated, the better.
Thank you. Would anyone else like to answer that?
I agree 100% with what Michelle was saying. I think that it's just important to let people know that, everyone needs to do their part, and, wearing your mask can save lives. And, it's very important to do it. It's not that uncomfortable. Like I said, I think I've gotten used to it because I wear it all day, every day. But it's very important to wear your mask to keep yourself safe, keep your family safe, keep your friends, coworkers, everyone safe. There's hope out there. The vaccine is hope. And just, everyone just has to keep writing it out, just encouraging, and, just keep on giving that hope. And that's what we try to do with the hotline. That's what we do with the task force. And I know public health does that. And so I think that's one way to just let people know, just, keep going. We're not there yet, but just keep going.
Yes, that's true. I do have a question from the audience, and it has to do with, you have like another health problem like diabetes. If you have diabetes, could the side effects be any more worse if you didn't have diabetes?
I think that might be for Michelle, but I know people that have chronic pulmonary conditions and diabetes, and at the hospital, like patients, and a lot of the times they're fine. A lot of our farm workers that do come out, they call. We actually people call back and say that they were grateful that they got an appointment and they didn't have side effects, or maybe they were tired, or things like that. But for the most part, I mean, I haven't heard many horror stories. It's just, the typical symptoms of being tired, fever, body aches, chills, or just a headache. So, but maybe Michelle has more.
Yeah, and I would say, in fact, those with underlying health conditions, diabetes, type 2 diabetes specifically was mentioned. That is one of the new priority groups that we're saying it is more important for you to get vaccinated, because it is these groups that are dying and being more, hospitalized at higher rates than the rest of the population. It is quite concerning. Those with underlying health conditions are the ones that indeed should be vaccinated. However, anyone that has any questions needs to talk to their doctor if they have any concerns. But the Centers for Disease Control has been very clear on this. The only people they are saying to not get the vaccine are those that have a history of allergic reaction to any ingredients that are in the vaccinations themselves, or the vaccines themselves. So that's from the CDC. Again, talk to your doctor, but there is no evidence that you would have more, of a harder reaction because you have these underlying health conditions.
Thank you. I have another question, and it could be for anyone who wants to answer, but it's from the audience. Do you think COVID causes depression and anxiety to worsen? Do you think sometimes people overthink the side effects and it causes them to think that they have side effects? So it's dealing with the issue of how's COVID had an impact on someone's mental health, and also has that led to anxiety and other things?
So I'll go ahead and answer that, and then I'll hand it over. So as a community leader, and many of us and all of us on this panel are community leaders. In the beginning, when this pandemic happened and people were getting more educated and finding out what this pandemic was about, and it was real, and some of us think, oh yeah, it'll just go away, and we'll be back to work the next day. Well, here we are a year later, and it really doesn't matter who you are. You could be a doctor, you could be an attorney, you can be a teacher. It can happen to everybody. And I've seen that, because I've spoken to people who call me because they feel embarrassed. I can't even imagine, and this is why we formed the hotline, and we launched it on December 15th, because we didn't want folks to feel isolated during the holidays. We didn't want them to feel like they didn't have anyone on Christmas, on New Year's. And so whether it's your abuelita, whether it's the grandparents, whether it's folks that just live by themselves or have a huge family, sometimes just driving home, you're thinking in the back of your mind, like, do I have this, or can I get this? Can I really get this pandemic? So there's a lot of anxiety, there's a lot of isolation and a lot of depression. And, I accidentally answered the hotline one time, a gentleman from Shafter, and he was just, basically yelling at me and saying that he didn't have his COVID results yet, et cetera. And I just let the gentleman just vent and yell and do whatever. And why have, COVID testing if you're not going to get back to me in 3 days, et cetera. So it could be anybody. And you just sit there and you just listen. I have some folks in the community that, who have had it, that don't really want to talk about it. And yet they still have to do their daily tasks and be out there in the community and do what they have to do. And lo and behold, they say, my father was in the military. I've never been in the military, but, those folks are saying this feels like a mini PTSD, that I'm getting. So I feel for them. We have this helpline, this hotline as well. And I'll go ahead and turn it over to Bianca.
Yeah, I mean, everything that Jay said is true. I worked on Christmas and New Year's and took a lot of calls, and people just wanting to talk. A lot of people, I mean, anxiety is having fear, of the unknown. And so a lot of people have different forms of anxiety. And because we're in a pandemic, it's incredibly heightened. There's a lot of people that are washing their hands constantly and they're getting rashes because they're scrubbing too hard. There's people that use bleach on their body to clean themselves because they don't know. And so it comes in a lot of different forms. And I think it's important to, pick up the phone and call someone, even if it's not our hotline, it can be a friend, a family member, just to call someone, because these are all signs that you need help and you don't know how to navigate it, because you might not even know that you have anxiety, because that's been the biggest thing, that when people tell me how they're feeling and what they're going through, and I'm writing down, I send it off to my counselors and they're having anxiety, panic attacks. And I'm like, yeah, that's what I agree. That's what I'm hearing a lot from callers. And so when I asked them, have you ever had problems like anxiety before? They're like, no, that's for crazy people. And it's like, no, that happens to a lot of people and it's completely normal and they're not alone. It's common. And so that heightened sense of the unknown, because we're living in an unknown right now. And a lot of people they need help. And so that's what the hotline is there for, because we have counselors to help them and figure out all those emotions that they might not have had before, or they have had before, and they're just really heightened. Because like I said, there's people that didn't go to Christmas because they were too scared and their family was making fun of them. And they had anxiety from that they were scared of what their family was going to think, or if they had to cancel last minute. Or they had to work and they're just on high anxiety because they have to work. There was a lot of hotel staff that called in that had anxiety going to work because they had to clean the hotel rooms because people were renting hotels to stay if they were COVID positive, and they were just nervous to go to work. And that's also why, we have coping mechanisms for people, and we, get them in contact with our counselors so they can have further talks with someone that can help them figure out their emotions and how to deal with them, especially during this time. So anxiety is a big thing that everyone is going through. And I would say that it's definitely heightened since the pandemic, because they don't know whether if they lost their job or they can't go back to work, or, they're on Zoom for teachers. There's a lot of different reasons as to why someone is experiencing anxiety or their anxiety is going through the roof. So I would say to talk to people, don't be afraid to pick up the phone and call a family member or your friends. They're there too. They're probably going through it just like you. And you just need to talk it out. That's what I tell people is the best medicine, talk it out. And the hotline's there for you. We have counselors available and ready to talk to you as well, but definitely talking and figuring out what your emotions are. And that's the best medicine. If you can't be face to face right now, pick up the phone and talk to someone.
I'll add that I've seen this firsthand with my own mother. I noticed a change in her the past few months, losing weight, sick a lot. And so I kept pressing. I'm like, what's going on? What's going on? And so she finally came to me and shared that she felt that she needed to go see a therapist because she's, very depressed. And that was a big deal for my mom, because she just doesn't believe in therapy, talk therapy. And so I found a Latina therapist to take her to, and she's been to 2 sessions. So I see her slowly coming back. And what was hard for her too was not being able to visit her sisters in Orange County or her family in Mexico, because she would go at least, once a quarter to visit her family. She hasn't seen them in a year. So I told my mom, I said, once, you're fully vaccinated, I'll give you some time off, because she's my babysitter. I said, you could go visit your sister. So she's leaving for a month to go visit her family. They've been fully vaccinated. So, it was really hard making sure that my parents were taken care of at the beginning, delivering groceries to them, outside, and just waving from the car. It was hard. So I've shared this with Jay, because, it was very, very hard for her. And I can't imagine the people that are calling the hotline that don't have, a child that is able to help them find a therapist, or, deliver groceries or talk to. So it's been very, very hard.
Michelle, is there anything you want to add?
No, that was all fantastic, except I think we've all had a lot of stress this last year, and thank goodness for places like the Latino and the hotline, because that's so needed. I think, there's the physical impacts of COVID, but the mental health aspects are significant. So
With that, you talked about some of the struggles and obstacles and challenges that all of us are facing as we deal with the pandemic. Is there a success story? Do you have a success story from the work you do, or from something that over the year that you're really proud of and what you've experienced or seen? All of you.
So there's a lot of success. We could, especially being that I had COVID in the very beginning, March 19th of 2020. I could have sat here and I could have sat at my home and felt sorry for myself. I could have felt like a victim, even though it was so new. But what I did is, when I knew that I was going to get better because of my faith, and I knew that I was going to get better. And when I co-founded this Latino Taskforce with H.A. Sala and David Torres, and at the time, Matt Constantine, it was truly a success. And I want to say, as we saw the numbers rise in Latinos, I want to clarify with everybody, we named it the Latino COVID Task Force because we wanted to help. We wanted to help Latinos and educate them and understand. And we wanted to make sure that we stop the spread in the Latino community with education. But being the Latino COVID task force, it impacted everyone for the better. We were not trying to, say that Latinos have it, harder, although the numbers say that the COVID numbers daily were just rising and rising, and you see them now and they're up there. But this is really for everyone. And folks can call the hotline in English and Spanish, Punjabi, Tagalog, whatever it is. So I'm really proud and I feel success. I don't think that I'll feel success until we get back to normal, whether that's in a year or two. But hopefully, Michelle and I worked on over 100 locations, 35 census tracts of COVID testing, but getting to know different folks, getting to know what public health was about, working with, Connie and Perez-Andreesen with the farm workers. We put all of our differences aside and we all worked together, and everybody had a big role to play. And Bianca doing an amazing job with the hotline and the helpline and scheduling older folks to finding transportation for them. So that's a big success in itself. And to me, I'm very thankful. I'm grateful for everyone on the task force. I know this is not about the task force, but we all are a part of it. And I just wanted to say, from Olivia to taking wonderful notes as fast as Matt used to speak, and you all jot them down, but jot those notes down. But anyways, I feel success. We have a long way to go. And please, as I mentioned earlier, just take the vaccine and get the vaccine when it's readily available to you. And that's the success that I felt.
I'll just add, I think most recently, a success story has been what I mentioned earlier, that our movement entities and the Latino Task Force are doing out at the 40 acres and vaccinating our farm workers. When we first started planning this, we didn't know if they were going to come. We were nervous, but because of the significance of the property to, our farm workers, it's a safe place. And, Jay is a trusted person in the Latino community. So they knew that if he was behind it, with the United Farm Workers and Cesar Chavez Foundation, then okay, we're going to be okay. Because when we first started planning it, I got some calls of people asking if ICE was going to show up. And that was a fear. And I thought, oh my God, that's horrible. And luckily they came. People were lining up outside of the 40 acres as early as like 8 o'clock in the morning, waiting to get in. And we've been able to vaccinate over 1,000 farm workers each weekend. And like Jay said, it took different people coming together with, different views when it comes to politics or, whatever it is, because we knew that the main goal was just to vaccinate our farm workers, because they can't work from home. They can't have Zoom meetings and work from home. They've been out there every day picking the food that we consume every day. So it's been nice just to see the support from the community, from local businesses donating money to feed our volunteers, and also the volunteers signing up and coming out. It's been a very emotional event, just seeing some of the farm workers coming out crying after they have their vaccine, because they feel safe now that they're going to go back to work. So to me, that's, it's a huge success story that would not be possible if it wasn't for the support of our partners, with Bianca and Jay and the county as well. Of course, Kern Medical is a vaccinator. So it's been a great partnership, and we look forward to vaccinating more people this weekend.
Michelle, Bianca.
Yeah, I mean, I feel like almost every call that I take is a success story. um, I think like, people call in with questions, they're worried, they're scared, like what Connie was saying, that's been the biggest fear for people calling in, that they say, I don't have papers. Is that okay? And I'm just like, yeah, like you can go to 40 acres, I'll sign you up. And I want every phone call to leave on a positive note. And I think that's been the success for the hotline, at least, that, we started out with, 2 operators working full time, myself and my other operator, and then Jay would jump in there. And now we just added on 3. And I have a bunch of volunteers. I have people calling from the community, calling to the hotline that they want to help us. And honestly, I thought that was probably the biggest success story for us, because I felt like, we're trying to help the community, and other community members that are able stepped up as well. So I've had teachers, I've had government workers call in and, ask if they could provide their services. And, I train them, and they help us with voicemails and callbacks and things like that. So I'm really proud of our community members that have stepped up and wanting to help get people, vaccinated, get them scheduled. I do have a lot of people that have been, like in December, I had this guy call in almost every week. And I'm not afraid to give my name. So I tell people, you can always call back and ask for Bianca. And this gentleman, like, I explained to him what the hotline was, the mental health aspect. And, we have counselors if he needs help, like, and he was like, no, I don't need help. Like, I don't need to talk to anyone. I'm fine. But then he would talk. And so I would just sit there and listen, and, before I knew it, like 20 minutes would go by, 30 minutes would go by, like all of a sudden it was like 45 minutes and he's still talking, and I don't want to interrupt him because, he was skeptical about talking to people. So at the end, I would like tell him, like, we have counselors, like trained professionals that you can talk to, and they can place you with someone to talk to, and make this something like that you can do, have appointments and go do, and just, let out anything you have. And he's like, I don't need to talk to anyone. I'm fine. And then we could call it another week, and we would talk for like 30 minutes. And then he would call the next week, and we would talk again. And then about a month and a half later, he decided to get help. And he realized, like, we talked about issues with PTSD due to, like, being a veteran, a lot of the isolation, like what Jay was saying, like it came back to him. He couldn't be around family. There was a lot of different issues that he wasn't realizing because, being at war and being a pandemic were different things to him, when in reality, they're both wars, so he finally agreed to talk to a counselor. So I set him up with Dr. Hirakawa, and Dr. Hirakawa was able to get him the help that he needed, especially being a veteran and dealing with, other past issues that weren't resolved. So that was probably, I don't know, I guess my feel good, like, yes, like, we're helping a lot of people, but, that was one I was like trying to get, to get some help for. And so there's a lot of people that do call back, and just want to talk and vent, and they're like, okay, I feel better, bye. And so I don't want to push, getting help and counselors. I just tell them, like, that's what's available. Because there's like a stigma that mental health is just for crazy people. And I just tell people, like, no, it's talking to someone, it's healthy. And, you can tell someone, you're not going to tell your parents or your siblings something that's very personal because you might be afraid of how a family member might react. It's always better to talk to a third party that, is non-judgmental or anything, that they don't even know you. So whatever you say isn't crazy to them. And so I think that that's probably, the theme of the hotline is definitely people call in that they're grateful. There's a lot of gratitude. crying. I cry a lot. So when someone starts crying and they're just so thankful that someone listened to you, like I just sit there like, don't cry. My family makes fun of me, but it's just been a really gratifying, like rewarding experience. And I'm just glad that we can, help people like this. And so that's why I feel like a lot of the calls that do come in are my own like little success stories. So, but it's been a great experience. And thank you, Jay, for, I guess putting me in this position. I didn't know that I was going to do everything that I'm doing. I thought I was just putting ideas out there, and then all of a sudden I started doing everything. So, but I'm glad I did. And Jay trusts me for that. So.
You do a great job at it. My hat goes off to you every single day. We're very thankful. Yes, she did not know. And we would have these planning meetings. And so one day, Dr. Hirakawa and I said, we're ready to go. We have the plan. We had processes in place, training manuals, we had everything. And so I said, let's just ask Bianca if she wants to take the lead, and we're very thankful.
Well, thank you, everyone. We are approaching the very end of our session. Very informative and inspiring. I would like to ask you one thing, in one sentence, if you have one message to our students at the college, what would it be? And each of you, if you could share something before we close, one message you would want to give students.
I guess the message I would say is get involved. There's a lot of people that really care about this community, and you can contact any one of us to get involved. And it's just really important. I've always been taught that we have to give back to our community and we have to take care of our community. That's what I've grown up with. Those are values that have been instilled in me since I was little. And I've brought those values into me as an adult. So just get involved with the community, give back to where you live, and try to help out as much as you can.
I'll jump in. Don't give up hope, because hope is here, and we are getting toward the end of this, and it's been rough. So stay the course, keep with us, but keep hopeful, because we're close. And thank you for all you've done.
I'll just, add to that. Not to lose hope. I know that for a lot of students, they've missed out on a lot, right? Graduations. I have a junior in high school, so proms, hanging out with friends. It's been hard for students. I can't imagine being a student in the middle of a pandemic. So the fact that you guys, have made it this far, just don't give up hope. And if you can, definitely, as Bianca said, get involved. Anything helps. There's, I'm sure, a lot of volunteer opportunities at the college they could help with. And if not, reach out to any of our organizations for any volunteer opportunities.
So I just wanted to say to the students, I want to echo what everyone has said about, please do not give up hope. Hope is on the way. Help is on the way. And also, I want to thank the students, those students who have gotten involved, those students who have helped, that your parents who have, if they've gotten COVID and you've stuck by their side. And I know it's really hard to have this really crazy schedule where you're homeschooling and you're on Zoom, and then, you have to cook and clean and make sure that everybody is staying safe. So, thank you to the students. And I want to echo what Bianca said was to to always give back to the community. And this is the place that we live and work, and we're gonna be here, and we're gonna get through this together. And I know that sounds touche, but we will, because all of us on this panel are living proof that we're gonna get through this together, because we have leaned on each other, all of us. So thank you to the students as well.
And with that, on behalf of the Bakersfield College Women's in History and More, WHAM committee, and of the Office of Student Life, I want to thank all of you for participating in this panel. Thank you very much, with much gratitude. You guys are great. So thank you all the audience who was here and attended. I hope this was very informative for you. We'll see you next time.